So how to identify the early stage of BBFTD and FTD in general is quite challenging, especially with the BBFTD, because patients not always have awareness about their own deficits. They are more the caregivers who identify this kind of deficit. And the main problem with that condition is that it's highly misdiagnosed and confounded with psychiatric conditions like, bipolar disorder, depressive disorders. Early symptoms usually are apathy or disinhibition or subtle changes in personality. So the people become, more disinhibited, or some person become like pathological gamblers. They spend the money, or they, start to not complying with social norms, and not using tacit social knowledge to saying, appropriate things in social interaction. So this is a very difficult behavior to identify. So in primary care, it's almost impossible to diagnose, except in some countries with a huge infrastructure. The best approach, in my opinion, is the consensus group, because you need to coordinate neurologists and psychiatrists. And this is not easy at all, because, BBFTD is a typical neurological condition, but all the early signals are psychiatric symptoms. So we need really consensus group, and geriatricians, neuropsychologists, and occupational therapists are quite important to identify the early diagnosis. It's quite challenging. And in Latin America in particular, we have shown that around 50 and 70% of BBFTD cases are initially diagnosed as psychiatric conditions. One critical aspect of BBFTD is the incapacity to respond to subtle, implicit, contextual information. So when you are facing stressful situations, you need to carefully control different information for the environment and self-regulate yourself and be able to develop an adaptive behavior. This is disrupted in BBFTD. In particular, the environmental demands can create, a kind of increased stress that, in allostatic terms, in terms of self-regulation of the body signals, cardiovascular signals, visceral signals, responses to these environmental demands, requires a very subtle regulation that is impaired in the behavioral variant of frontotemporal dementia. We should remind that autonomic deficits, cardiovascular deficit, and particular interoceptive deficit, like the capacity of sensing and self-regulate the emotional and body signals, are impaired in this condition. So environmental demands usually trigger or exacerbate the initial responses in frontotemporal dementia. So when in challenging conditions like, COVID, when you have to completely change your habit, restricts your behavior, become quickly adapted to so many different situations, can be a huge stressing, triggering factor for early BBFTD presentation.